I just wanted to, I guess it's my turn, talk about some of the work we've been doing in partnership with ACC to try and make it easier for people to access concussion services if they need them. And I'm just waiting for my slides to pop up. And this is followed on from some of our previous work where when we've had discussions with people who've experienced these injuries, one of the things we heard time and time again was the hardest thing in my recovery was navigating our healthcare system. And we've heard this morning about how difficult it is to get to a GP. And I guess, this is a program of work we're doing with GPs to try and make that easier. But very mindful of not everyone having a GP, and so we are looking at extending this out to other areas because this isn't something that needs to be done by a GP. It's specifically designed for any health professional to use. So what we're hoping is once we've shown that this works and we refine it to where it needs to be, it's something that can be really free and accessible for anyone who's a healthcare professional to use. So I guess to start in terms of, well, what do we know right now? Well, what the evidence tells us is that specialist interdisciplinary rehab services, or what we call concussion services here in New Zealand, improve symptoms, they improve functioning, they improve quality of life, and there was a really good meta-analysis done which really supported the effectiveness of these services. We also know from some of the work from Jan and Penny in the room that if there's a delay in concussion to get it to a concussion services, that can actually increase people's symptoms. And so actually by not giving people the access, we're potentially making them worse. And so we need to speed things up and make it easier for people. Now, when we started this piece of work, 6 or 7 years ago now, we had a look at what tools are out there to see if there's something that we can use that we haven't realised yet. So we did a big review. Unfortunately, we didn't find anything. Tools like the sports concussion assessment tool, they just don't work in the ED or in primary care. Great for the sports context, but they take about half an hour. And we all know the state of primary care at the moment. Even getting an 8-minute consultation in a 2-week time frame is pretty hard. So we needed something that was going to be much quicker, much briefer for GPs to use. But the good thing that we've learned over the last 10 years, since we realised that mild TBI isn't necessarily very mild at all, is that there are a number of risk factors for people who have a delayed recovery. So we actually do know some people who may be struggling in their recovery. And so what we wanted to do is to make those really accessible for GPs and to identify those early so we can then refer people early. So what the group started with is a bit of a brainstorm in terms of our current healthcare system. And one of Patria and my PhD students did some great work looking at ACC data and how patients move through the healthcare system for mild TBI specifically. Now, one of the first things that she showed was that there are more than 3,000 different ways through our healthcare system. No wonder it's complicated, no wonder people are struggling. So this here is one of the most common pathways where people go to a GP, they get referred, ACC approved it, and then they went to a concussion service. But what she found was that people don't necessarily present on the day of their injury or the day after, which we thought they would do. They actually present sometime after when they haven't got better. And then look at this time frame. Between going to your GP and getting a referral to a concussion service, you're looking at an average of 55 days. Now, by that point, people are really struggling. They're really frustrated. And so that's where we thought, that's where we need to target. We need to reduce that down. We then used to have a period where the referral got approved by ACC, but based on this work and some work and a lot of badgering from other people, we got the ACC approval removed. So we've already cut down that top part of the time frame, which is great. And then you can see actually once the referral's received by concussion service, people are generally seen pretty quickly in around 6 days. Now, interestingly, in the international guidelines, it suggests that everyone should receive at least one follow-up Doesn't matter who it's by, but just to check in to see, have you recovered or not? And when we looked at how often that was occurring here in New Zealand, 36% of our people were getting a follow-up by any health professional, whether that was a phone call or a physio or a GP or a concussion service. So very, very few people. There's also some additional challenges in, someone mentioned this study earlier, that GP confidence in managing concussion is low. They're very confident in diagnosing these injuries, but in terms of managing them, they were telling us they needed more support. They told us that the process of making a referral was really cumbersome, and they didn't necessarily know what services were out there and who they should be referring. And what we heard also from people with lived experience was that the current pathway relied on them having the knowledge and the ability to go back and ask for help and to know when to do that. So it really put pressure on people who were already in a difficult space to make that step. And obviously there's lots of barriers to getting to a GP, like not having a GP, not having transport, or getting an appointment. So that was something that we really needed to sort out. We need a proactive pathway. And the other thing we've become aware of is that there's ethnic inequalities in who was getting referred to concussion services. And so that's something we also needed to address. So what we did as a working group, and this is very, very much a team effort, we had GPs on board, we had ED clinicians, we had sports physicians, we had people with lived experience, we had people from ACC. It really was a multidisciplinary group of people brainstorming essentially how we can do this work. So I acknowledge all of their time and contributions. And so we developed what is called now the Brain Injury Screening Tool. And what that aims to do is to operationalise those known risk factors for delayed recovery. So things like having a TBI history, if you've had multiple injuries. So we've kind of put that into a question format so that GPs can just ask these questions as they would in a normal consultation. It identifies people who are at high risk of complications and need to go to hospital. Those, as I mentioned, at risk of delayed recovery, to refer them to concussion service or physio, and then those who can just be followed up in primary care and given some good advice. So the tool was developed for people aged 8 years and over. It asks about the incident, how the person responded. It's got a 16-item symptom checklist, really focusing on symptoms that are important at that acute point of the injury, not a comprehensive assessment tool of symptoms chronically. And it has an overall impact of the injury, because the other thing we were hearing from people is the symptom questionnaires ask about my symptoms, but I don't have many symptoms, but the ones that I've got make my life really difficult. You know, if you've got a labourer who's struggling with dizziness, finding it hard to go back to work, that's someone who needs support. And so we wanted to make sure that we captured the impact of those symptoms as well as the symptoms themselves. So the great thing about having ACC on board is they were also able to provide some infrastructure around this tool to make it practical to work in primary care. And so there's this, what we're trialling at the moment, called the Primary Healthcare Pilot for Mild TBI. So as part of this pilot, we've got a number of sites set up. The patient presents to their GP. They have their initial clinical exam. The BIS tool is completed. They're given recovery advice. The clinician then decides if there's been a mild TBI or not. If they're not, then they come out of the pathway. If they have got a mild TBI, they come into the pathway. And then the tool recommends whether they go to the ED, the concussion service, or they're followed up in primary care. Now, what's been amazing is that ACC has funded the second and the third appointment, so it's free for patients, so it takes that cost barrier out. And then what happens if someone stays with their GP, if they're low risk, they're expected to recover well. There's just another clinical review, the BIST is completed again to track that recovery, and then there's a third appointment if needed. If the person hasn't recovered, they can be referred at those later appointments. So rather than, as you can see, the linear trajectory that we had before, now we're connecting services in until people come out because they've recovered. So that's the pathway that we're testing. Now, in addition to this, we know we needed to upskill our GPs, and so we developed an online training program with ACC. We've updated the recovery sheet, and I've been really disappointed that this doesn't seem to have been widely distributed. So if people aren't familiar with this, please come and find me and I'll direct you to it, because this is something we worked really hard on, and it's more about advising patients on getting back to activity in that first week, so the first 48 hours in the first week. So much more informative than just the red flags to look out for. And then we've also set up an automatic referral system. So it's very easy for a GP now just to hit that refer button to make that process easier. Now, one of the things we learned very early on is that GPs doing the follow-ups was often problematic. It was really hard for them to actually book someone in 7 to 10 days' time. And so we're now onboarding physiotherapists to provide those follow-ups, as this tool was designed to be used by any health professional, and then that gives them guidance so that if the person isn't recovering, then they can be referred back into the system. So I'm pleased to say, for some of you would have already heard this presentation before, but I'm going to share with you some latest results from this pilot. We're just preparing a report for ACC at the moment, so some of this I analysed yesterday. So I will frame this as being preliminary in case I've made an error, but it's looking, I'm sharing it with you today. So after our initial start in Auckland and Canterbury, it got expanded out across New Zealand. We've now got more than 100 GPs using this tool. We've screened more than 660 people, and so although it was really hard to get GPs on board at the beginning, at the start, as you can imagine, they were just like, oh, this is another thing to do, I don't have time. Once they started using it, GPs kept using it, and that's been really encouraging to see. And we've just done a follow-up survey with the GPs, and 80% have reported finding it useful or very useful, so that's been really encouraging. So what's happened to people in primary care following this pathway? So you can see here, this is where they go to the GP. There's about 2% that are recommended to go to an emergency department, so that looks about what we'd expect, very few. About a third are going to a concussion service, which is great because of all the studies that are showing long-term effects from TBI, showing that about 30 to 40% of people are likely to have long-term problems. So that's mirroring what we were hoping for. We've got about 6% going to physios, and then we've got 60% roughly staying in primary care and being followed up. Now, what's really good to see is that despite the challenges of GP availability, you can see here a large number of our sample were actually followed up in primary care, so that's really encouraging. What's also really cool is that people who went to a concussion service, their GP stayed in contact. So they were getting support from their GP as well. So that was really, really good to see. So the other thing that we wanted to look at was, can we improve that rate of follow-up? So we went up from 36% to 63%. So that's been really cool. And on average, people are getting 2 appointments with their GP. So those who had more than one appointment with their GP, because I was really worried about the safety of this tool, particularly for those staying in primary care. You can see here of those that the scores generally improved over that time. So there was a mean improvement of 12 on the BEST tool, and we've heard from people that the minimally clinically important difference on the BEST is 10. So we really are seeing quite a big shift, or a meaningful shift in scores for people who are staying in primary care. So the good advice and the monitoring is working. You can see here that 28 of the 44 people who got worse in that follow-up appointment, most of those were referred back into a concussion service. So that was really great that that pathway of following later on was working. Another one got referred to a physio, 3 were referred but decided not to attend. That's their call. There's one case that we're following up on where a referral was recommended by the tool but the GP didn't make it, so we're just following up on what happened there. And 11 had really low symptom scores. So when we were looking at did people get better or worse, it was generally a case that they went from a 10 to a 6, which for those of you who know the BIS tool, really you're looking at scores over 60 that are problematic. So they were people who have a very low level of symptoms, and in the normal population you'd expect a score of about 20, so they were sort of in that range. So that seemed to be working well. And then what happened to our concussion services referrals? This was really exciting. So last time I presented this, I presented that we went from 55 days to 37 days. The data last week 9 days. So we really have narrowed down that time. And so we're really hoping that by getting people the good advice quickly, we can try and prevent some of these long-term problems later on. The other great thing is there was no difference in the referral rate for any of our ethnicities. So that was also really good to see that this is now making access to services much more equitable. And then in terms of who attended, after a referral was made, I was very conscious that maybe some people didn't feel these services were necessarily what they wanted, but you can see here quite clearly that Māori and Pacific actually uptook those services more than Europeans, but Asians not quite so much, and so that's something that we need to take a look at. Sorry? It's very hard to get interpreting services. Yeah, you're right. That could well be one of the issues. So what we've done, we took very much a test and learn because we want this to be something that works. And so I've had to sort of move out of my hardcore research space and actually go more into a usability space, but make sure that we've got the research behind it. But we've been making changes to the tool as we've gone through. So when we initially started, we had people being recommended based on having one risk factor. Now, that may have been a risk factor such as presence or a history of a migraine or history of mental health, which in and of itself doesn't necessarily make a referral to concussion service appropriate if there's a low symptom level or low impact. And so we were hearing some feedback from GPs that, this tool isn't necessarily as specific as we want it to be. And so what we've done now is we're looking at a weighted combination of symptoms. So to see if we can refine that specificity much more. And it has indeed addressed those cases that were recommended to be referred by the tool but actually didn't need to be. So where we're going, we're going to be expanding this out to other GP systems. We've had a lot of GPs who don't use the MedTech system where this is currently available asking for it, and we're now setting up a platform to enable us to make this available to other GPs. As I said, we want to have a look at whether our refinements are actually making the right difference. And I'm really pleased that we've just heard we've got a grant from the Health Research Council to now test the tool in EDs and accident and emergency clinics so that we could, wherever people go, hopefully they'll get the same advice, the same standard of care, the same triage and access to services. That's our plan. So it'll be really good to see how that works in the ED space as well. And so what does this mean? Well, for those of you who have had an injury, unfortunately, this isn't really going to change much. But if anyone has an injury going forward and their GP is part of this pilot, hopefully now you'll get much better advice. You'll get to service quicker if you need them. And as I said, we're really trying to make this much more equitable access. And ultimately, our goal is, as I mentioned, if we can get people the right advice quicker, hopefully we can improve people's recovery, get them back to work sooner, and prevent these long-term problems that we're seeing. And that's me. If you want to find out more, there's all my details. Always happy to receive emails or tweets or comments. Always really keen on feedback from this tool. So look forward to hearing from you. Thank you very much. So are there any questions?